right. Breast cancer gets a lot of attention, but prostate cancer does not get the same attention, and that's why we've invited our next guest to come in and talk about it, because it is Prostate Cancer Awareness Month. Dr. Amit Chakrabarty is a urologist at SSM Healthcare, St. Clair Healthcare. Good morning, doctor.
Good morning.
What should we know about prostate cancer?
Well, prostate cancer is a very common cancer. People do not realize this. Prostate cancer is the second commonest cancer amongst American males and the second largest killer amongst American males. So it is a very, very important and very common disease and very serious if it is not treated.
That's the important part, if it's not treated.
That's correct.
Which means if it's caught early, your chances are much better.
That's right.
Okay, so take us through, and this is very convoluted and very confusing. When should men start getting checked?
American Urological Association has come up with recent guidelines. They have said that between the ages of 55 to 69, men get the maximum benefit of being screened. That means that the more lives are saved in this time span or this age span.
Gotcha.
They also advise to check maybe every 2 years rather than every year like we used to recommend before. People who have family history of prostate cancer or African American males should be treated earlier.
Why are African American men more negatively affected by that?
Because African American males have a worse cancer. I mean, the worst stage. They are diagnosed at a worse stage. Their mortality is higher, and that's the reason we tend to have this subgroup of people. Like I said, family history of prostate cancer,
right,
or African American males. We suggest that they need to be checked earlier. After 69, you should not. I mean, it's not like we are saying do not check it. If you if you consider yourself that you have a life expectancy of more than 10 to 15 years, or if you are concerned for any reason, there is no reason for you not to discuss this with your primary care doctor or a urologist.
There's also a philosophy that maybe, just maybe, if you're diagnosed, you don't get treatment.
That is true. There are various treatment options for prostate cancer. In fact, if the prostate cancer is very small, very low grade, and you are towards the upper age limit, you can do what's called active surveillance. We used to call it watchful waiting. Now we call it active surveillance. That means we check your PSA every so often, and keep a close watch on it.
Right.
Maybe repeat a biopsy if the PSA goes up, and act at that time.
Because it's such a slow growth cancer, your quality of life will be such that it makes more sense just to watch it as opposed to try and treat it.
That's right. The prostate cancer, like you said, is slow growing cancer. However, there are tortoises which are slow growing cancer, but there are some hairs, maybe 1 or 2 out of 10 will have those cancers which are a little bit more aggressive.
Yeah.
Till now, we're doing a lot of tests, a lot of ways to try to find out which two. Unfortunately, we do not know which of the ones which will progress early.
Yeah.
So consequently, we tend to treat that because we don't want to be those two.
Yeah.
Number one. Number two is that prostate cancer treatments have come a long way. The data which lay public have today are from decades ago, or maybe at least a decade ago. We have come a long way. We do robotic prostatectomies. We do prostatectomies, which means removal of the prostate gland. We do it at a much, let's say, the morbidity which has been quoted usually with removal of prostate gland or treatment of prostate cancer has gone down quite significantly.
Will men show symptoms?
Yeah, good question.
Will they show them or not?
Unfortunately, prostate cancer at early stages have no symptoms. Only symptoms are towards the later stages when it has spread. So men do not wait for symptoms to come. This is what has happened. Men consider themselves macho, and they don't come to the doctor to get themselves treated because it involves a rectal exam, digital rectal exam, and a PSA. And I mean, on the other hand, women get their mammograms and pap smears all the time.
Exactly, and that's not fun, but we go through it.
Exactly. But men, they have to be oftentimes dragged by their wives or significant others to come over for the screening.
I understand that. That makes perfect sense to me. I'm 47. You're telling me I don't, and I have no history in my family of prostate cancer. You're telling me that I should not be checked yet.
Well, there's another school of thought which says get a PSA checked once or twice between 40 and 50, and if it is less than 1, do not worry about it. So get one baseline value, because we have seen prostate cancer at a younger age too.
Yeah.
So one baseline value, let's say you get a baseline value of, let's say 3.5 or so. That is concerning. We will repeat it. We won't just rely on that.
Right.
In about 3 months, repeat it. But if it remains there, I will be concerned.
Doctor, what about a enlarged prostate? What does that mean?
Enlarged prostate, thanks to our testosterone or androgens, which every male has, the prostate gland continues to grow. Some of those prostate glands, when they grow, they kind of squeeze the urethra tube. Urethra is the tube that leads from the bladder to the outside that drains the urine. Prostate acts like a vice grip right below the bladder where it sits, and it just compresses the flow. And some of these people who have enlarged prostates have difficulty urinating, going to the bathroom very often, rushing to go to the bathroom, frequency, getting up at night to go to the bathroom, stopping and starting while urinating, and straining to urinate. All these are symptoms of enlarged prostate or prostatic obstruction, or what we call lower urinary tract symptoms.
Are there drugs or things to be done for an enlarged prostate?
Yes. When the enlarged prostate is symptomatic, there are medications which can take care of it, and there are also minimally invasive therapies which can be done in the office without anesthesia, without surgery, which can take care of this for variable period of time. Also, there are now much less morbid procedures like lasers, which a person can have the prostate opened up to be able to void or urinate much freely.
So just because you have an enlarged prostate doesn't mean you have prostate cancer?
That is absolutely correct. Enlarged prostate does not mean prostate cancer. Conversely, on the same vein, if I remove your prostate, or if I open your prostate channel up for enlarged prostate, you still need to continue getting your PSAs done, because you can still get prostate cancer.
Right. That's really interesting. And so
Yes.
the only thing is, you got to get the men over the idea that it's embarrassing, or I don't want to do it, or don't bother me. Get in there and get your PSA checked.
That's correct. In fact, people who do not want to come to the doctor, we have even gone out of the way. In fact, we just did a prostate cancer screening at one of the car dealership locally. We had 3 days there, and I was there on one of the days, so the people can come and ask questions. Obviously, at that time, we didn't do a rectal exam.
Sure.
We just did a PSA. So if you're not convinced in getting going to the doctor or getting a rectal exam done, at least go to one of these free screenings and get a PSA done.
Dr. Amit Chakrabarty?
Yes, sir.
Fascinating. Thank you very much.
Really good
You're
stuff.
welcome.
Really interesting. Urologist is SSM Healthcare. It is Prostate Cancer Awareness Month, and breast cancer gets a lot of attention. And I guess to sort of break down the barriers is men need to talk about it more, and just it's okay to go and get your prostate checked.
That's correct.
Yeah, doctor. Thank you. Good stuff today.
Appreciate it.
7:30 here. Big